Assalamu alaikum students. Hopefully all of you are fine. Now I'm telling you about another topic of the antidepressant drug. Novel targets for development of antidepressants. All currently available antidepressant medications include the SSRIs and SNRIs, which act on the monoamine system, were developed from studies of the mechanisms of actions of serendipitously discovered drugs. However, more than 30% of patients with depression remain resistant to a series of treatment, and furthermore, several weeks are often required for the full-blown antidepressant effects of these medications to manifest. Therefore, there is a need to develop new antidepressants that act via mechanisms different from those involving the monoaminergic system. One of such novel glutamatergic system includes the abnormalities in the glutamatergic transmission have been implicated in several psychiatric disorders, including depression, and agents acting on the glutamatergic system have gained much attention as potential novel medication for the treatment of depression. Among the glutamate receptors, M-glutamate receptor have important roles in regulating glutamatergic transmission. Recently, blockade of the M-glutamate receptor has emerged as an attractive approach to treat depression. Metabotropic glutamate receptors. The M-glutamate receptor, which is also called metabotropic glutamate receptor, comprises 8 subtypes that are classified into 3 groups. These groups belong to the family C G protein coupled receptor, which have the relatively large N-terminal extracellular domains containing a ligand recognition site to which the endogenous ligand glutamate binds. Glutamate receptors classification includes the M-glutamate 1 and the metabotropic glutamate 5. Group 1 includes the M-glutamate 1 and M-glutamate 5. Group 2 contains the M-glutamate 2 and the M-glutamate 3. And the group 3 includes the metabotropic glutamate 4, 6, 7, and 8. Here you can see that. Metabotropic glutamate receptor mechanism of action is, here you can see that the blockade of presynaptic M-glutamate 2 and 3 receptor increase synaptic glutamate release and the stimulates postsynaptic alpha amino 3 hydroxy 5 methyl 4 isoxazole propionic acid AMPA receptor activity. Stimulation of the AMPA receptor leads to an increase in brain-derived neurotropic factor BDNF secretion, which stimulate its receptor tropomyosin related kinase B. The TRKB activates AKT mammalian target of the rapamycin complex 1 signaling, which eventually increase synaptic protein synthesis and spine formation. There is a mechanism of action of the metabotropic glutamate receptor. Antidepressant effect of M-glutamate 2 and 3 receptor antagonist. Now we will see the antidepressant effects of the M-glutamate 2 and 3 receptor antagonist in animal models have been demonstrated in several studies, and accumulating evidence has confirmed the antidepressant activities of M-glutamate 2 and 3 receptor antagonist in several animal models, including on the mechanisms implicated in the etiology or pathophysiology of depression. The antidepressant activities of M-glutamate 2 and 3 receptor antagonist is summarized in table mentioned in the following slide. The fourth swim test for the rat, Spurgy Dolly rat, compound and the effect. Mouse, compound and the effect. These are the antidepressant effect of M-glutamate receptor antagonist in the animal models. There's a tail suspension test. Differential reinforcement of low rates of responding. Vista rat is used, which show no effect. Learned helplessness, we use the rat Spurgy Dolly. Antidepressant is subchronic. There is a cortisone treatment, methamphetamine withdrawal, social isolation rearing, chronic unpredictable stress, and the chronic social defeat stress.